Hi, I'd like to welcome everybody to another episode of MD Insight, and I'm really excited to be here today with Rebecca Garazatua. Becca is nurse manager on what we call H50, which is a colorectal surgery nursing floor at the main campus in Cleveland Clinic. But it's a little more than that now, and we'll talk about that over the next little while. Becca, welcome. Good morning. Thank you for being here.
Thank you for having me.
So maybe you'd tell the audience a little bit about yourself and a little bit about, maybe up until February of this year of what your team and what your floor looked after.
Sure. So I manage, as you said, a colorectal surgical postoperative unit. And typically we would care for up to 36 patients after different types of colorectal surgeries. In semi-private rooms, we have nurses, PCNAs, health unit coordinators that would care for the patients coming up after surgery. We would make sure that patients met certain milestones and help them prior to them being discharged home or to a skilled nursing facility. And so our staff is really knowledgeable about the colorectal surgical patient and takes pride in taking care of this patient population.
Yeah, I can attest to that. Knowledgeable, outstanding, brilliant team, and looking after everything from quick enhanced recovery cases going home next day to multivisceral open resections that are there for a while and have really complicated situations. So Certainly as surgeons, we thank you and your team every day for what you do, because it allows us look after our patients really safely and really well. Critical part of the clinic. No, truly, it's a pleasure. But that all changed mid-March, right? So your floor was the main campus floor that received the first COVID patient. So obviously that was a great honor and compliment to you and your team's skills and recognition that everybody felt you could handle that. But at the end of the day, that's a big change in workflow and team and philosophy. So maybe you can talk a little bit about the initial emotions and day-to-day changes that happened in that first 24 hours.
Sure. So as you said, we had the first positive patient here before we had transitioned into a rule-out COVID floor. And so it was a lot of collaboration, a lot of learning, getting information from nursing education, from ID on the process of, donning and doffing appropriately, what we should be using for PPE, and, a little bit of fear, but the staff really jumped in and did a phenomenal job with that first patient. And then eventually, as surgical volume went down, we did become a floor for patients under investigation when they started arriving at main campus. And every day, new information, and everyone was very adaptable. And we, the leadership team at the clinic, I commend, because everyone's been very transparent, sharing knowledge, and the staff has really appreciated that. And is interested every day in hearing updates and new information.
Yeah, so a lot of things were happening in parallel back then, right? So we had teams working on what were the right PPE guidelines and education and protocols for how patients would flow through the hospital. But you and your team certainly lived it right at the beginning. So as we were able to reduce volume of patients and make sure we were being as safe, appropriate, and careful as possible, that gave you a little bit more bandwidth. But in the beginning, how did the team respond? Because it was a pretty stressful situation.
It was, and so it was constant communication. We typically huddle once a day. We were, on the unit huddling more often. Whenever new information came out, we'd share it. We'd ask for, responses, opinions from the staff and get their input. Our clinical nurse specialist, Maya, was often on the floor. Our nursing director was here very often. So just a lot of, talking through situations, making sure people knew what they were doing. When we had new teams coming to the unit from the medicine team, Dr. Giamacci and her team asked us to make sure that the physicians were donning and doffing appropriately as well when the new staff would come on. And the nurses really have been taking pride in making sure that everyone's staying safe with that process. So, watching others putting on their PPE appropriately and making sure they're taking it off appropriately. So a lot of different things, and they've really taken pride in making sure this is all being done to keep us all safe.
So tell us a little bit more about the donning and doffing and the supervision of that, because there's a buddy system and there are teams, and obviously it's something that's done very carefully, particularly when
Correct.
people are looking after a definite COVID positive patient. Not that
Right.
it's any different for a PUI, but that's obviously when people are really at the most heightened sense of awareness. So talk maybe a little bit about the process.
Yeah, so at first we had, videos that we had every staff member watch. Sometimes it would be the first time they would have been here on the unit in a couple of days, or they had floated to other areas. So we made sure they watched that video. We walked through it with our clinical nurse specialists at Huddle, how to appropriately don and doff. And then for the first time, we would use the buddy system to make sure that people were appropriately putting on PPE, and also catch any other specialties, physicians, physical therapy going into the rooms to ensure that they were also putting on their PPE appropriately. And we reviewed how to doff appropriately too, because the doffing on our unit's a little bit different because our doors are closed. We can't see somebody doff. So we went through how to do that prior to the first time the caregiver would go into a room.
Yeah, and I think a lot of it's around standardization and care and practicing.
Right.
And what PPE were people wearing going into the room mostly? Respiratory therapy may have been a little bit different, but what was the PPE involved, and what did you guys use?
So a regular face mask, eye protection, a gown and gloves.
And then the respiratory therapists use an N95 because of the aerosolization of respiratory therapy.
Right. So at times we would have nurses wear N95s depending on, so if we had a patient on high flow oxygen,
Yes.
or with a CPAP or BiPAP. So there were certain situations where our staff would wear N95s as well.
Yeah, and those guidelines were put together very carefully with ID and infection prevention and other teams of
Yes.
clinical specialists to try and find the right ones for the right people at the right time. You mentioned as you were talking the huddle process and the daily huddle. That might be interesting for people to hear about. Maybe tell us a little bit about the huddle that you do on the floor and the kind of things that are discussed in the huddle.
Sure. So every morning, we usually do it at 7 in the morning, and now we're doing it more often, but to catch both day shift and night shift, we review patient census. We typically would review in the past, surgeries that day, any patients with central lines, urinary catheters, fall risks, any patient who needs a patient companion. And so now we're more reviewing any updates with change in process with COVID. We still talk about our census, talk about changes. So a couple of weeks ago, we went from being just EUI to also having positive patients and how that looks. So we're trying to have separate caregivers take care of the positive patients than the rule out patients. And so just talking through that, and it's very interactive. If people have questions, I take those questions, and I have a tier 2 huddle at 8:30, and I can ask questions there and escalate things if needed.
Yeah, I think the huddle process has been fantastic, both on the physician institute clinical side for us, but also on the nursing floor side. And it's really become a very structured and standardized way of getting information to people who need it to make changes, and then also of percolating information back to improve
Definitely.
process. Yeah, so it's really good. Tell me about how the team have responded, because you really had a fantastic team before all this happened. And I certainly have my own perspective on how the team responded, but you led them through it. How do you think people functioned or are functioning now after going through all this?
I think our team is just phenomenal. They've really come together. They've stepped up in a lot of ways, learning new ways of doing things, becoming, I think, leaders amongst themselves on, what the best processes are to bundle care. One of a challenge we've had is we've actually had a lot of new staff start. So nurses, patient care nursing assistants, and how we are going to train those people, preserving PPE, as well as giving them experiences taking care of colorectal surgical patients. So also a lot of our nurses and PCNAs have been open to float to other areas. So these new caregivers get those experiences on H51 when we have had colorectal patients on G90. And then they've also been able to, get to know caregivers on these other units. And it's just been a really great team approach. I think Our assistant nurse managers have done an awesome job communicating, listening to our caregivers with scheduling issues, with floating. So I really want to commend Amber, Abby, Jerry, and Sophia, who've really done a good job and have been great leaders through this as well.
Yeah, well, I'd like to commend you. It's been
Thank you.
fantastic. But I think what you did was, with everybody else, you brought a really highly functioning team to another level. I mean, it's really impressive to see the camaraderie, which was always good, but it's kind of almost upped the game in a way. It's really interesting, and we've seen this in different areas of the organization. The pressure of working in this situation has allowed people bond even more quickly and more strongly. Are you finding that the new trainees or people who are coming to work on the floor are settling in even faster because there's such a focused mission, so to speak?
Yeah, definitely. And everyone's been the new employees have been very open too. We've been transparent with them. This is kind of a different, world we're in right now. This is a different situation. So this is how we're trying to give you what you need during orientation. And, they get to experience other units more quickly than they used to, and see how things are done and get to know that workflow that we're used to. But then also, towards the end of the orientation, we let them be on H50 as well, just to kind of see how it worked here.
So the other thing that's changed a lot is the profile of patients you're looking after, obviously. Because they're not all colorectal patients who are PUI or COVID. These are patients from different specialties. And obviously it's been a multi-specialty floor, multidisciplinary. There's been a lot of multidisciplinary care, but this is different. You're meeting a lot more medical providers and other specialties as the primary providers. I'm not going to ask you whether you prefer colorectal surgeons to the others, but maybe you'd talk a little bit about having different services on the floor and some of the changes that you've noticed with that.
No, I mean, they've been great. So we've dealt a lot with the medicine team, and every week it changes and really open, and the doctors are very easy to get a hold of. We're communicating a lot with Dr. Giamacci. We've also seen a lot of, transplant patients as well as cancer patients. So dealing with those different physicians, and everyone has just been, I had a doctor email me last week from the leukemia team about our nursing staff, and everyone's been great to work with.
Yeah, I think it's been exciting. Watch a good organization, well, a very good organization. The clinic's been a special place to be, but not just on the nursing side. Every other team come together and function better. It's been an exciting time, and I think it'll set us in an even better place to provide care to patients in the future.
Definitely.
Yeah. Well, are there any other thoughts you have or things you'd like to bring up in the closing minutes?
I just want to say thank you for all your support, and the team here really appreciates. I think it's even been heightened what a great organization the Cleveland Clinic is to work for, how much support we've gotten, how much information. I've been getting a lot of that feedback from the team here, so thank you.
Oh, not at all. I mean, we truly are a team of teams. It's a great phrase, and it's very appropriate at the moment. Becca, thank you very much for taking time to join me. It's been a privilege learning from you about some of the things you've been accomplishing with your team over the last couple of months. Thank you for all you do.
Thank you, Dr. Delaney, for the opportunity.